everyone, my name is Yukshi Tariq.
Mari Iqbal.
Samara Javid.
And Santa Chugtai, and we're pharmacists from Huddersfield. So we're here to deliver a workshop about diabetes. So we know some of your academic studies cover diabetes, so we're going to be talking about that in association with diabetes. Also about how, just to enhance your general knowledge about the disease and how we as pharmacists apply it to our practice in the real world.
Okay, we're going to look at some learning objectives now. So guys, these are learning objectives for today.
So by the end of the session we should be able to cover all of these. So to understand the difference between type 1 and type 2 diabetes.
To know the factors that influence blood glucose levels.
To understand the role of insulin and glucagon in controlling the uptake of glucose by cells and the hormones involved in the interconversion of glucose and glycogen.
And we're going to be looking at the role of the liver in glycogenesis and gluconeogenesis.
And the control of diabetes through insulin and through the manipulation of the diet.
And diagnosis and treatment of diabetes.
And we're going to finish off with some exam questions, which you guys will be taking some exams in the summer, and we're also going to show a case study, give you guys a try of that. So guys, I'm going to look at some words that are associated with diabetes. So does anyone, what comes to mind when you guys think of diabetes?
Insulin.
Insulin, well done, great. Any other words?
Glucose.
Glucose, yeah, that's good. Any other words related to diabetes?
Pancreas.
Pancreas, brilliant.
The liver.
Liver, that's to do with the pancreas, which is really good. Anything else? Anything to do with lifestyle and diabetes?
Diet.
Brilliant. Guess what, Harry?
Exercise.
Exercise, well done. Any other processes or like any other words that come to mind when treating what the body does produce? Anything else?
Glucagon.
Glucagon? I think that's enough. I think that's got the main points in. Got one more missing, but we'll go through them all. So I'm just going to go back to Samara and she's going to go over with more detail.
Okay, so guys, you did really well on that exercise. I'm actually now going to go over the keywords for you. So the first keyword we're talking about is glycogen, and this is a polysaccharide and it is the main form of carbohydrate storage in animals. It is made mainly in the liver and muscle tissue, and it is converted to glucose when the body needs it to satisfy its energy needs, and it is usually called animal starch. Glucagon is a hormone produced by the pancreas, and it stimulates an increase in blood glucose levels. So it increases your blood sugar levels and therefore doing the opposite of what insulin does.
And now insulin, which you guys mentioned, it's a hormone secreted by the islet of Langerhans. Does anyone know what the islet of Langerhans
Are there cells in the pancreas?
Cells in the pancreas, brilliant, well done. And they function in the regulation of blood glucose, so they stop producing glucose by they convert into glycogen. Another thing insulin does, which is not related to diabetes as much, is that it's in part of the metabolism of carbohydrates and fats. And finally, glucose, which is a monosaccharide sugar, is used by living things to obtain energy, and it's used for respiration, and it's the main sugar that is circulating around our body.
Okay, so insulin is a lifelong condition, that is when the person's glucose levels is too high. There are two types, type 1 and type 2. Type 2 is the most common in UK, and 90% of adults that have diabetes have type 2 diabetes.
Yeah, so currently there are 3.9 million people in the UK that are living with diabetes, and that's more than 1 in 16 people. Okay, and this figure has doubled since 1996 and expected to go to 5 million in the next 10 years. So as we know, it's vital for us to diagnose it as early as possible, because that's the best way we have of treating it, and it gets progressively worse if we leave it untreated. Okay, so the first type of diabetes, type 1 diabetes. Does anyone know anything about type 1 diabetes?
Is it like the body has no insulin at all and it can't like produce its own insulin?
Yeah, that's key to it. Anything else that we know?
Is type 1 diabetes to do with genetics as well?
Yeah, genetics do play a key role. So I'll just discuss it a bit further. So this is caused by an autoimmune response where the immune system actually attacks the insulin producing cells of the pancreas, which are the islets of Langerhans, which we mentioned earlier. So actually this causes the body to not be able to produce any insulin of its own, and therefore blood glucose can't be lowered. So this type of diabetes is actually insulin dependent because of the absence of insulin, and as we heard earlier, there is a genetic predisposition, which means that we actually can't produce the insulin, and it's actually lifestyle independent, which means any manipulation of diet or increase in exercise or anything can't actually control the blood glucose levels, and because of the absence we can actually treat it with insulin alone. So the second type is type 2. Does anyone know anything about type 2 diabetes?
Is it when the receptors are like they're denatured and they can't bind onto the insulin, so they can't break down?
Yeah, so it has something very important to do with receptors and insulin. Anything else that we know about it?
Is type 2 to do with poor diet?
Yeah, so poor diet and slightly lifestyle can affect it. So it is actually primarily caused by lifestyle. So this is actually where the glycoprotein receptors on the skeletal muscle cells are already like occupied and blocked, so insulin can't actually bind to it. This is actually due to lipids, so like we said, the poor diet and the lack of exercise causes a high level of lipids in the blood, which actually block the receptors. So, Mario, can I use you for a demonstration? Right. In a normal healthy individual, a normal insulin, so I'll be insulin and Mario will be a skeletal receptor on skeletal muscle. So normally I would bind to Mario, so I'll demonstrate that with a handshake, and then the glucose can actually just flow into the smooth muscle, into the skeletal muscle, and lower the blood glucose. So here, I'll just handshake and I can bind and glucose can enter. Whereas when we have type 2 diabetes, so lipids, which we will represent with pens here, is going to occupy her active site. So they can't actually, I can't shake her hand because I can't actually bind to it. So there is no interaction between the insulin and the receptor. So I can't bind, insulin can't bind to the receptor, and therefore glucose can't actually be lowered by going into the cells. So that was our little demonstration. I hope you understood that. Made it clearer to understand. So we said that is due to poor diet and poor lack of the exercise.
Okay, so now we're going to look at the factors that influence glucose levels. And I'm actually going to be talking about what makes blood glucose levels rise. Do any of you guys have an idea of what can make blood glucose levels rise?
Eating too much food.
Yeah, that's correct. Anything else?
No exercise.
Yeah, that's also another factor. Okay, so I'll just go over some factors. So of course, like you said, not being active. Not being active means your muscles aren't using the glucose, and therefore your blood glucose levels will continue to be high. Not enough oral diabetes medication, and that is of course if you are already diabetic, you shouldn't be taking these medicines if you are not. Also side effects from other medications such as steroids and antipsychotic medications. Obviously as pharmacists we are constantly dealing with side effects, and we've seen that blood glucose levels do rise as a result from these medications. Like you mentioned, too much food, like a meal or snack with more carbohydrates than usual. Illness, so your body actually releases hormones to fight the illness, and this makes blood glucose levels rise. Stress again, hormones are produced which again raise blood glucose levels. Short and long term pain, for example, if you get a sunburn, your body will release hormones that will raise your blood glucose levels. Menstrual periods and also dehydration.
So what makes glucose levels fall? So by looking at what could make glucose levels increase, what do you think would make it decrease?
Too much exercise.
Yeah, too much exercise. Anything else?
And like not eating.
Not eating. Good. Good. Anything? No? Okay, we'll have a look. Not enough food, like one of you guys mentioned. Alcohol, especially in empty stomach. So basically, alcohol just causes your glucose levels to drop, especially on an empty stomach, because you've got no food in your stomach anyway, no carbohydrates, so it would make it drop even more. Too much insulin or oral diabetic medication. So if you are diabetic and you're taking too much of it, sometimes it can make your glucose levels actually drop. So, you know, diabetics can actually have their glucose levels drop suddenly as well. Side effects from other medications. So there are some medications out there that can cause your blood glucose levels to drop. For example, beta blockers. So they bind onto the beta receptors and they can cause, an example could be propranolol, which is used for hypertension, so high blood pressure, but they can also cause blood glucose to drop.
And that's called hyperglycemia, in case any of you
Yeah.
guys was wondering.
Hypoglycemia, actually.
Hyper. You learn something new every day.
More physical activity, like I mentioned, so too much activity, so your muscles are constantly using the glucose, which will constantly make the glucose levels drop.
Okay, so I'm going to be talking now about something called glycogenesis. I'm sure you may have come across this before in your lessons, but just by looking at this word, does any of you guys know what it is? Considering I've split this word in two, as is in two different colours. Any of you guys, do you have an idea?
Genesis, do you know what Genesis means?
Genesis, it's...
Does it mean production?
Yeah.
Yes. So if that means production, what do you think glyco stands for?
Glycogen.
Yeah, glycogen. So yeah, you're right. It's glycogenesis is the production of glycogen. So yeah, it is the formation of glycogen from glucose, and it is synthesized depending on the demand for glucose and ATP. If we have high amounts of glucose and ATP in the blood, then insulin will promote the glucose conversion into glycogen for storage in liver and muscle cells.
Okay, gluconeogenesis. So again, what do you think comes into mind? You know, split into three now. So we know Genesis means production. What would gluco refer to?
Is that the glucose?
Glucose. And neo. Does anyone know what neo means? It's Latin, I think. Is it?
It is Latin.
Yeah, it's a Latin word.
Yes, yes.
Yeah, it sounds a bit like something. New. Yeah, brilliant. So gluconeogenesis is producing new glucose. So we're going to have a look at it now. So gluconeogenesis is a process of synthesizing glucose from non-carbohydrate sources. So non-carbohydrate sources, so producing brand new glucose from where there is no glucose. So for glycogen, that has glucose that is stored up. So this is brand new for no carbohydrates. So it's a metabolic pathway which results in the generation of glucose, and from non-carbohydrates, things such as pyruvate, lactate, and amino acids.
Yeah, and glycerol.
Also, it occurs mainly in the liver, and small amount also occurs in the kidneys as well. It's really small amounts also occur in the brain, in the skeletal muscle, and in the heart muscles. Does anyone know why it might occur in these places as well? What's important about the skeletal muscle? What do skeletal muscles always want?
They need glucose
They
to
need glucose.
respire.
To respire. Fantastic. Heart muscles also they need their glucose as well. Brain is the only source of energy for the brain is glucose, so that will need glucose. So gluconeogenesis also occurs in these places as well too, because they have a high demand for glucose.
Yeah, and a little tip for you guys, that is why you cannot study while you're hungry, because your brain is always requiring glucose. So as your exams are coming up, I thought I would just make
That
you know.
makes sense.
Yeah. Okay, so my colleague mentioned that, you know, gluconeogenesis is constantly occurring in the liver, and it is produced. So glucose will be produced in the liver, and that will go to the muscle here. As muscles are constantly requiring glucose, they are constantly moving and constantly working. Glucose is then broken down to lactate, and this releases ATP, and ATP is the form of energy that is used. That's how our body uses energy, basically. This lactate, produced from the muscle, will then move to the liver, and again, gluconeogenesis will occur, more glucose will be made, and this will then go as a circle.
Right, so the role of insulin. Does anyone know what insulin does?
It breaks down glucose.
Kind of. Any other ideas?
Does it like lower your blood glucose levels?
Yeah. So it's secreted by the beta islet of Langerhans cells in the pancreas when the blood glucose levels are really high. It does lower the concentration of excess glucose in the blood, which is homeostasis. Does anyone know what homeostasis is?
Is it to do with the body levels being maintained?
Yeah. It's either positive or negative feedback. Do you know which one?
Glucose.
For glucose, yeah.
Negative.
Negative, that's right. Insulin increases the permeability of cells so that more glucose could be absorbed. And then the absorbed glucose can be stored as glycogen for energy. It also increases the rate of respiration of glucose by cells. And there's a constant secretion of glucose throughout the day. And this may be after a meal because the levels of glucose increase. Also, as the blood glucose falls, the levels of insulin also decrease. Now, the role of glucagon. Does anyone know what glucagon does?
Does it decrease glucose levels?
I think, doesn't it increase blood glucose levels? I think does it increase blood glucose levels?
Yeah, you're right. It increases blood glucose levels. It's secreted by the alpha islet of Langerhans cells. Now you can notice that insulin was secreted by the beta islet of Langerhans cells. Glucagon is secreted by the alpha islet of Langerhans cells. This may be during exercise and during meals to increase the blood glucose levels. It binds to receptors on the cell membrane of liver to break down glycogen, which is a store to glucose. It also promotes the formation of glucose from fatty acids and amino acids, and also decreases the rate of respiration of cells for glucose. Now you might notice that there's some flashcards on your desk. I would like you to work in pairs to determine the mechanism of insulin and glycogen, please.
Need the red ones.
So I think these red ones are what makes it rise. So what is it? So
I think pancreas for
yeah,
bottom.
pancreas detects blood glucose levels that's too high.
Would it, no, I think
Beta cells secrete
they
insulin,
still love it.
and
Then so does it bind onto the receptors?
yeah, so glucagon will bind to lower insulin.
Yeah.
No, to make it higher, insulin will bind to lower.
Yeah.
So then cells take up more glucose.
Glyconeolysis.
Yeah.
Yeah.
So the breakdown of glycogen.
Yeah.
Yeah.
And then this will get.
Yeah. So there'll be less glucose in protein.
Yeah. Think good.
So now that you're done, how did you find that?
It was alright. It
Yeah.
kind of made sense now how it's
Yeah.
kind of like the opposites.
Yeah, it was good. I think I understand it more now.
That's good.
Yeah.
Right, I'll just go over the answers. Okay, so from a normal blood glucose level, a rise is detected by the pancreas. This leads to the beta cell to stop secreting. Beta cells secrete insulin and alpha cells stop secreting glucagon. So cells take up more glucose and they require more glucose for energy, and glucogenesis is activated. This leads to less glucose in the blood and the homeostasis is maintained at lower as normal levels are returned. On the other hand, when there is a fall in blood glucose level is again detected by the pancreas, and then alpha cells secrete glucagon and beta cells stop secreting insulin. This leads to gluconeogenesis being activated and cells require less glucose, and then the cells release glucose into the blood and normal levels are returned again.
Oh, is that when you said a negative feedback? Is this what it means?
Yeah, this is negative feedback.
Okay.
So when there's too much high levels, it returns it to normal, and when there's too low, it returns it to normal by increasing.
So
again.
does like the body just know by itself where the glucose levels are high? And
Yeah, is detected by the pancreas.
Oh,
The
okay.
Isle of Langerhans cells, do you
Oh
remember?
yeah, yeah.
Oh
It's detected by the Isle of Langerhans cells in the pancreas.
Okay.
And they respond exactly to what level they detect. So that makes sense with the either being positive or negative. So whether we need an increase or a decrease.
Body's quite clever.
Yeah, it's
Yeah,
actually
it is.
very clever.
So this is homeostasis. For the glucose.
Thank you.
Okay, so now we're going to be talking about the symptoms and diagnosis of diabetes. So with symptoms, there are some symptoms that are very typical, very obvious, but it's not always the same. Some people may get loads of symptoms, some may not even notice at all because they're so mild.
Sometimes it might take up to 10 years for the symptoms to show up.
Wow.
Yeah.
10 years.
So-
That's a long time.
So
Yeah.
some people just get the symptoms, but it becomes unnoticed. So do any of you guys know what the symptoms of diabetes might be?
I think I know that people get thirsty a lot.
Yeah, they do. So they do get thirsty.
Also, the urination, going to toilet a lot.
Yeah,
Yeah.
yeah.
That's correct. Anything else?
There's weight loss, isn't there?
Yeah. Do you know why there is weight loss?
You're not wrong.
Because
Isn't
that is
it?
good that you noticed it.
Isn't it like the skeletal muscles can't actually use the glucose, or none of the cells can actually use the glucose that's in the blood, so they start breaking it down from the other places, like the proteins and
Yeah.
lipids, so muscles and fat get reduced because of it?
Do you know what it's called?
No.
It's called ketosis, and that's really good that you know
Yeah.
that right now.
So basically in ketosis, the body is using other sources. So the common symptoms of diabetes is urinating often, which you mentioned, which is good. Feeling very thirsty, again, mentioned. Feeling very hungry, even though you are eating, they still feel hungry. Extreme tiredness. Blurry vision. Blurry vision, does anyone know why blurry vision occurs?
I'm not too sure.
So blurry vision is because your glucose levels are normal and happening in the body. It causes a lot of osmotic changes in the body. So in the lens of your eye, because the osmotic changes there's osmotic changes happening, it could cause your lenses to swell, to build up with fluid, which can cause your vision to be blurry. It normally it does get better in time. You don't have to worry. It's not a long-term condition or something like that. You just get, once you start managing your glucose levels, it's just osmotic changes happening.
So of course all these symptoms can be suppressed when diabetes is treated, of course. They are irreversible. So another symptom is actually cuts and bruises that are slow to heal. If you see someone with diabetes, they will get a cut. If they get a cut or a bruise, you will notice that it stays there for a very long time. And the reason why that is because the bacteria likes to feed on the glucose. Because people with diabetes have a high blood glucose level, it's basically food for the bacteria, so they thrive on that food.
Oh, that makes sense as well, because wounds often have a large blood supply, so
Exactly.
they keep getting that glucose.
Yeah, and
Well done.
another one is weight loss. Even though you're eating more, you'll still lose weight.
Tingling pain, numbness of the hands and feet. And one second, I just want to ask you guys, you mentioned urinating often, and you also mentioned feeling thirsty. Does anyone know why? Why this happens? Anyone have any ideas?
Aren't you
Is-
like...
Is it when the body's trying to get rid of excess
Yeah.
glucose?
So you
they
lose
do
a
it
lot
by
of
water.
actual fluid as
So
well.
yeah, so your kidneys
Other
constantly
water.
trying to get rid of the glucose, and with the glucose you're getting rid of water, which makes you thirsty at the same time, and you're going to the toilet.
Yeah.
So yeah.
Yeah, so that's really good.
Okay, so now we're going to move on to the treatment side of it. How we just mentioned the symptoms and the diagnosis of it. So once that's done, we actually treat it. So type 1 diabetes, we remember that there's no insulin.
Yeah.
So because of the lack of insulin, we can actually give insulin. But how, does anyone remember how we give it again?
Well, isn't it because insulin's a hormone? You can't give it as a tablet, can you?
Yeah. So how?
Would it be
how
an
would you
injection
do
on your thighs or your?
Yeah,
I've
I've
head?
seen some people inject.
Yeah.
I think, is it a protein as well? That's like.
it? Yeah.
Yeah.
So that's perfectly right. The fact that it's a protein and we can't actually take it orally because of it being digested. So the actual, what are the proteins in the stomach? Do you know what?
pepsin.
Yeah, sorry, the enzymes in the stomach. So that's the enzyme, that's pepsin, and that's why you have to actually give it subcutaneously, which is your injection. And this is given, the dose just matches how much glucose the person is taking in, so through their calories, what they're usually eating. And that way we can actually give the insulin and the mechanism still working perfectly fine, and that can be successful in reducing the blood glucose levels. So on the other hand, we have type 2 diabetes. Insulin is already present in high amounts, so do you think insulin is going to treat it?
No.
Yeah, you're right. So it's not going to do anything because it's already there, and the mechanism and the action is not even working. It's not triggering the reduction. So actually, the way we would do this is through regulating diet and exercise. So we would increase our exercise and control the diet of our, like, the intake in our diet. So things like the carbohydrates and the sugars that we're taking in. Also increasing fibre and reducing fat, because what was the fat for? What do you know what that is associated with again?
The lipids.
Lipids.
The lipids, yeah. So reducing the level of lipids in the blood would be really good for treating it. Also, so the exercise would also reduce the lipids in the blood because you're using that as the energy. So that would reduce that. Also, we have a drug, and you might have heard of this, might not have heard of it, but that's called metformin.
Magnetics, that.
Yeah. So you will know people who take these, and it's used alongside all the lifestyle advice, and it actually
Yeah.
You know how you said metformin, insulin, you can't increase the amount of insulin that's going to the body.
Yeah.
So what does metformin, what does it have?
So actually,
does it bind onto like receptors or what?
yeah, so what it does, it actually targets, we're not even dealing with the pancreas here, it targets the liver, and it causes, you know how the liver was constantly releasing that supply of glucose, converting it through glucogenesis? So what it does is it actually reduces that. So if you stop, you can't actually do anything to the uptake because insulin isn't working, that mechanism isn't working. So what we can stop is the liver from actually putting more glucose into the blood. Does that make sense?
Yeah, that makes sense.
Because the liver is still detecting that the skeletal muscle doesn't have any glucose.
Okay.
So it's going to make the liver will say, I need to put more glucose in because the skeletal muscles aren't getting it. But because of that, mechanism's blocked. And so we can actually target the liver to stop putting more glucose into the blood system.
Do you remember that the liver has a constant supply of glucose
Yeah.
as glycogen?
Yeah.
So it wants to release the glucose because it detects the body has too less.
So it stops the glycogen from releasing glucose?
Yeah.
Oh,
Yeah.
okay, yeah.
So it'll stop that process from happening. And therefore we can actually, we can't reduce the one that's already in the blood, but we can reduce how much more is being put into the blood. So that's metformin. You'll remember that now.
So guys, we want to do a case study. Of course, we as pharmacists, we constantly come across patients, we are constantly working with patients. They will just come to you with symptoms and problems, and it is our duty to be able to know how to treat this and what they possibly can have.
Yeah. So, what? Should we do that?
So basically, a 45-year-old obese woman is visiting her GP complaining of thirst, frequent urination, blurred vision and a chronic yeast infection. After obtaining the patient's medical and family history, the doctor performs the tests necessary to confirm the diagnosis. He then outlines her treatment options so that she may return to her everyday activities. So, first of all, just from looking at this, you should be able to see that we have come across these symptoms before, haven't we? Just now. Thirst, frequent urination, blurred vision, chronic yeast infection. So instantly, what do you think? What jumps out to you?
Does the woman has type 2 diabetes?
Possibly.
Yeah, possibly.
Yeah.
You always don't jump to a conclusion.
Yeah.
So when you would think the doctor or the pharmacist, if someone said that you'd suspect it, and then you do further tests.
So, as activities for you guys, we want you to think, what do you think is wrong with the patient? You actually just told me that. You think she has type 2 diabetes. So what tests could the doctor perform to confirm the diagnosis? And why do you think these symptoms occur? So we'll give you about 5 to 10 minutes just to work through those questions, and we will return to you with the answers. Sorry, what treatment options are available as well? Obviously we're pharmacists, we want you to kind of integrate this and look into practice. So guys, I hope you had enough time to answer those questions. We're just going to be going over the answers now. Actually, in fact, you can tell us, what did you get?
Yeah. So, okay,
So we said type 2 diabetes.
what tests do you think the doctor can perform, confirm diagnosis? Does anyone know?
Was it the urination test?
Do you
See the
want
levels-
to expand on that?
To
What-
check the levels of glucose in the urine?
Okay, yeah. And there's one more really common test that you can just do whenever. You might see it and your relatives doing it.
Was it the prick test on
Oh.
your finger?
Doesn't
Yeah.
that check whether you're in range or out of range?
Yeah.
Yeah.
So
So
basically,
yeah, it is in many households. It's a common machine. It's basically just prick your finger, a needle goes in, a bit of blood comes out, and then that machine detects how much glucose is in your blood.
so why do you think these symptoms are occurring? Does anyone? Well, we know we discussed urination, so the kidneys and everything. Blurred vision, we also did, and chronic yeast infections. Does anyone know? What do you think yeast has got to do with glucose? Where would yeast come into contact with glucose?
Does it use glucosol respiration?
Exactly. That's really good.
Really
so,
good, excellent. Yeah.
Excellent. So have a look. We'll go in and have a
We'll
look.
just go over the answers with you.
So we got suspected type. Yeah, brilliant.
Remember, suspected. It's always suspected until confirmed.
After the tests and more questions.
So yeah, urination
Urination
test,
test.
you mentioned. Prick test was also you mentioned. So yeah, first urination we did go through. It's because your sugar levels are high. Kidney
Must filter out more sugar. So exactly what you said before. Filter out more sugar, and then that way you lose more water.
Yeah.
And thirst and urination happens. Lead vision, I told you about the lens and things. So basically, osmotic fluid changes causes the lens of the eye to swell, and like I said before, it's not permanent. It's not that will be affected long term. If you have diabetes, it should return to normal as soon as you start managing the
Yeah.
glucose
So
levels.
it's normally within 3 months it
Yeah.
should be controlled.
Chronic yeast infections. Someone said it's got to do with glucose yeast. So you've got a high glucose level, and so places where you can have high glucose levels, like vagina secretions, in that place your glucose levels are generally high up throughout the whole body, and the area, the secretions, the vagina secretions, they have a high amount of glucose, which makes it nutrient rich for yeast. So yeast starts to grow. So you might have that patient. You might be saying, I'm taking antibiotics. That could be like, maybe she's got an infection, a yeast infection, chronic yeast infection, and that could lead to maybe diabetes.
Yeah.
So that's what it says.
So yeah, of course, increased level of glucose in vagina secretions means it's a nutrient-rich environment for yeast to grow. Again, coming back to the cuts, the idea of a cut. Whenever you think of glucose, just think it is food for bacteria. It is not good. When bacteria are exposed to these environments, it makes them grow even further.
Yeah.
So the yeast just continues to start growing off.
Yeah.
Yeah.
Off
And
that
we then
blood
need
supply.
to treat this. Yeah.
Oh yeah.
So,
What treatment options are available? So, Saba and Mari went over that with you to say a minute.
if you can just remember what they said, it's for type 2 diabetes. What
Yeah,
treatment?
respective type 2 diabetes. So we can't give.
Oh,
We can't give. What can't we give?
You can't give insulin.
Because there's
Yeah,
no point.
because insulin independent.
Independent. Yeah.
Is it the stuff about the diet and exercise?
Yes,
Just
diet and exercise. The most
controlling
important
diet.
thing is diet and exercise.
Yeah.
If you
So-
can manage that, that was the main point.
Yeah.
And then obviously what we're known for is giving drugs.
So of course, as pharmacists, that it is important that we always give lifestyle advice, because yes, we do give out drugs, but also
Yeah.
remember drugs do have side effects. We want to make sure that
It's safe.
yeah, diet and lifestyle is the primary reason, and therefore it is our role to make sure the patients have the right information. So yeah, healthy diet and regular exercise, of course. And of course medication. although we can't just rely on the patient to just, sort the diet out, start exercising more, alongside we will need to give medication.
Yeah.
And we did mention it was metformin.
Metformin was the prime example.
Okay, so this question is, explain how the formation of glycogen in liver cells leads to the lowering of the glucose concentration in the blood.
So what did you guys think?
So we just thought that the formation of glycogen will lead to a lowering of blood glucose concentration because the glucose concentration in the liver falls, I think, and then in the blood.
Is it-
behind blood.
Yeah, you're in the right
Is it
line.
glycogen in the liver cells leads to low glucose? So your glucose is constantly being stored as glycogen, so it's going to be that it's coming out of the cells.
Yeah.
So it's coming out of the cells, so that way
Oh,
it's
yeah.
lowering the glucose
Yeah.
concentration.
Yeah,
Yeah.
you're on the right lines. We'll just tell you the answers now.
Ah, okay.
Answers? So for this question, you just need any of the 2 points. You need 2 points. And you did mention most of these, but we'll just go over them.
So we said that the glucose concentration in the liver is falling. That's because of the process of glucose being converted to glycogen, and that's why the glucose levels in the blood are lowered.
Okay. Are these the answers from the exam board? Is that what the exam
Yeah,
board expects
they
us
will
to-
be. That's on your mark scheme. So
Okay.
exactly what you got and what you understood are perfectly in line with these.
Okay.
This is what they would expect you to know.
Okay.
So we have another
Do you
question
have
for
another
you.
question?
These are all on your desk, so you can have a look at this graph. And the next question is.
And these are the questions related to that graph.
So if you just have a go at this again for a few minutes, and then we'll.
Let me just go over the answers for you. You've looked at the graph. The question now for question 8A is the girl who took part in this investigation was being successfully treated with insulin. The graph shows that on some occasions the concentration of glucose in her blood was very high. Suggest why. So
It could be that she's eaten some and she hasn't taken her insulin yet. She's taken her insulin maybe later on to decrease it.
Or maybe like because she's just eaten a meal and then obviously the glucose will be absorbed into the blood, so maybe
Yeah,
that's why her.
That's
Yeah.
definitely right. So her having eaten, so any kind of carbohydrates or sugars in her diet, in her meal, that's what she's just had, immediately going to have an effect on the blood glucose levels.
we'll go over the answers in a bit.
And so the second part is using the graph to evaluate the use of urine tests as a measure of blood glucose concentration. Did you get anything for that?
It's a positive correlation between the two,
Yeah.
and some of the results overlap. And yeah, that's
I
what
don't
we got.
really know. It's because the urine test. Because I think the urine test is based on colour. It's quite subjective, isn't it? Like
Yeah. That's
about what colour it is. So
Yeah.
I'm not really sure how. to do
So
it.
You
usually.
can start discreetly.
Yeah.
Yeah. So we'll go over that as well. So that was there's some good points there.
And question B, diabetic people who do not control the blood glucose level may become unconscious and go into coma. The doctor may inject diabetic person who is in a coma with glucagon. Explain how the glucagon would affect the person's blood glucose concentration.
Is it the glucagon? It'll break down the glycogen into glucose, which will
Yeah.
make the blood glucose levels increase.
Yeah,
That's perfect.
It's called gluconeogenesis. That's what it's going to happen.
that's perfect.
That's
yeah.
well done.
Right, we'll go over the official answers. Right, so for question AI, you could use any of these 2 points. Because you had just eaten food containing carbohydrates and sugars, the glucose levels in her blood would increase as it is absorbed from the intestine to the blood. Also, it had been a long time after she had injected insulin, so she needs to inject insulin after she's eaten again. Yeah, that's it. Now question AI.
So yeah, one of you's mentioned positive correlation or directly proportional, meaning that they both increase. So they do overlap. So there's a range of results, not just like a fixed amount. And so yeah, you said urine tests are an arbitrary scale, not They're not to do with, it can be very subjective, but they can, that's why, what was the other test that could be a lot more accurate?
Was it the
Prick test.
yeah
The prick test. So that actually is really accurate in actually measuring the concentration in the blood. So that will give you an actual value, and it'll say whether it's in range or out of range. So that will actually give you quantitative data rather than something that will be a lot more objective rather than the urine test, which is very subjective.
Okay, so 8B, you could have any of these two answers. Glycogen is converted to glucose, which is the process called glycogenolysis. This is done by activating enzymes and also through the process of gluconeogenesis.
So is glycogenolysis the breakdown of glycogen?
Yeah.
Yeah,
Okay.
Yeah.
into
Yes.
glucose.
Yeah, it's just breaking out, splitting it, and forming the glucose molecule.
Okay.
Thank you for listening. And we hope you enjoyed our workshop and that it was very beneficial for you.
Lastly, if you have any questions, please feel free to ask us afterwards.
Or if you've got any questions now, it'll be fine.
Yep.
Thank you again. Thank
Thank
you.
you.
Good luck in your exams.
Good luck.
Thank
Yeah.
you.
Thank you.
Thank you.
Bye.